Hey, this is Jamie. I'm going to be performing our TPN and Lipid Infusion checkoff for lab. So get started. Um, First off, I'm going to look at the patient's orders and going to obtain any pertinent information related to the patient and the orders. So looking in the MAR and gathering any info that I need to know about the patient, either from the handoff with the nurse or looking in the patient's chart and gathering all that info. So I know as much as I can before I go into the room and start doing stuff. Um, I'm going to review the patient's labs since they're going to be getting parental nutrition and be paying close attention to all their labs. And I'm going to look at their INOs that were documented by the last shift and their most recent blood sugars. And I'm going to confirm that central line has been placed and that it's been confirmed by the physician and with x-ray. And then once I gather all that data, I'm going to go into the med room. I'm going to pull up my orders, do my double confirmations, comparing the physician's orders to what I have in the MAR. And I'm going to pull my meds. And when I pull my meds, I'm going to be checking the expiration dates. I'm going to be checking the clarity. I'm going to be looking for any leaks, any abnormalities. Typically, this stuff will come from the pharmacy and will be in a different location, possibly. If they don't come with the proper filters, I will call the pharmacy and make sure I obtain the proper filters, both for the TPN and the lipids, and also gather new IV tubing for the appropriate tubing and any other supplies such as IV pumps, alcohol, and flushes, what have you. So I have all that stuff with me in the room and don't have to go back and forth. If all that looks good, I'm going to gather everything up. That's my first med check. And I'm going to bring the equipment with me into the patient's room for the first time when I go into the patient's room. So we got Walter White here, aka my son's favorite new stuffed animal named Scaly. So I'm gonna knock on the door. I'm gonna perform hand hygiene. I got my hand hygiene here. I'm gonna perform that right as I'm entering the room, and I'm gonna ensure that the door is either closed or the curtain is pulled. Patient has privacy, the bed's at the appropriate height, all that good stuff. So we are all good to go. And I'm just going to introduce myself as a student nurse. I'm going to break the ice, get to know my patient, and I'm going to explain to them that the physician ordered TPN and lipids, secondary to them losing a fair amount of weight, the doctor ordered that so they can get some nutrition on board. I'm going to answer any questions they may or may not have. I'm going to explain to them that's why they have the central line placed, and we're going to be administering that through the central line, explaining that it's a long infusion. The TPN's 24 hours, lipids are 12. I'll explain to them that there's also insulin in with that, and that we'll be performing regular blood sugar checks, which they should be used to at this point. But I'll explain to them why we're doing that. We're going to be monitoring that. In the event that their blood sugar goes above what the physician has it set at, then we'll possibly have to start a sliding scale of insulin, and I'll explain that to them, and again, answer any questions they may have about this medication and procedure. At that point, I'm going to confirm that I'm in the right room. So I'm going to check the patient's wristband, checking their date of birth, first and last name, and then I can also confirm the MRN number. So we have Walter White here, date of birth 7/1/70. MRN is somewhere around here. I cannot find it. 987654. So I'm going to confirm all those three checks like I would with any other patient. And I'll be probably scanning that depending on where I'm working. At that point, I'm going to ask them if they have any allergies to medications, and I have on here that they don't, so I'm going to confirm that. If they do, we'll go dive deeper into that. I'm going to ask them if they have any new complaints going on since the shift change or anything new that has come about, and we will address those. And then I'm going to perform a patient assessment. So I've already looked at their labs. I've looked at their last CBG. I looked at their last INOs. I'm going to talk to them about their INOs. I'm going to listen to their lung sounds, make sure that they got good lung sounds and they're able to take on this new fluid. And I'm also going to inspect the central line, which we have placed here, and we've confirmed placement. I'm going to look at the dressing, make sure it's clean, dry, intact. I'm going to make sure that there's good blood return. I'm going to make sure it flushes. Anything that's going on, since we're giving a medication that's going to be infusing for a long time, I'm going to address that now so that we don't have to deal with that in the middle of the infusion. So I'm going to spend a fair amount of time making sure that's all good to go, so we don't have any complications with that. Again, I'll answer any questions as I'm getting to know them and doing all this stuff. At that point, I would perform a second check, and I would also grab another RN because this is a double RN med, similar to insulin or heparin or some narcotics, depending on where you work. So I got my trusty old buddy here, and this is my second RN. So I'm going to have them badge into the computer with me, and we are going to go through all the 6 patient rights together, confirming it's the right med, the right patient, right dose, right route, right time. And then we're going to pull up the medication, so the TPN lipid bags, and we are systematically going to go through the all the vitamins, minerals, electrolytes, and the dosages. And we're going to just go through all of those in order. So we're going to start with the acetate gluconate, 90 milliequivalents. They're going to confirm that back to me. Calcium chloride, 15 milliequivalents, and so on. I'm not going to go through all of that just to save time on the video, but we would take the time and carefully go through all this because, yeah, we want to make sure everything's right from the pharmacy and the physician's orders. And if there was any abnormalities or anything, I would get a hold of the pharmacist and we would address it then. So we would systematically go through all that, confirm allergies, confirm everything else, and also let them know that there is protonics that we're going to be giving them, and that's just going to assist with any possible GI upset and acidity, and hopefully address that. And I'll answer any questions that they may or may not have about that. So that's our second med check. I'm going to have the other nurse, they're going to sign on the med bag, sign in the MAR. We're going to go about all that, however it's supposed to be done per wherever you're working. At this point, I would also perform another bedside CBG, just so I had a more accurate, like real-time reading, just confirming that they're within the parameters that we want them to be in before we start administering the TPN, because it does have a fair amount of glucose in it. And then I'm going to don some gloves, and I am going to, I have all my appropriate stuff with me, so I'm going to prime the tubing, making sure it's all primed good. I'm going to confirm that I have the proper filters in place, so TPN is 0.22 microns. The lipids will be 1.22 microns. I'm going to make sure all those are on tight, everything's good to go. Again, I'm going to check the date on the bag, check the expiration. I'm going to confirm it doesn't have any nasty stuff in it. It's the right consistency. It's not leaking. Any abnormalities, it's going back to the pharmacy. And then I will perform my third med check at the bedside with the patient. Again, I'm confirming it's the right patient, the right drug, the right dose, the right route, the right time, and then I'll document once we're all done. They don't have any allergies, and I'm going to confirm they don't want to refuse the medication or answer any other questions they have. So we'll just assume that everything's good to go. We didn't find any problems. Lung sounds are good. Labs are all good. CBG's good. And we did our 3 checks. So we're going to basically, I'm going to hook it up. I'm going to scrub the hubs for 15 seconds at least, making sure we don't have any nasty bugs on there. I'm going to get a flush. I'm going to make sure we get blood return and also that it flushes easily without resistance. Again, just to avoid any complications since this is a long infusion. And I'm going to trace back. I'm going to hook everything up. I'm going to trace it back to the pump. And then I'm going to set the pump. We're basically going to go for 2 hours. And the order is for 60 milliliters an hour for 2 hours. And then the rate will be increased to 95 milliliters an hour. After that 2 hour mark, we would do another, perform another assessment and perform another CBG at the bedside, making sure they were within normal limits. And I'm going to basically begin the infusion. I'm going to take my gloves off. I'm going to document in the MAR. I'm going to label the bag, the date, time, my initials. It'll probably have the other nurses' information on there also. That way, at shift change and it's still going, everyone will know the TPN can run for 24 hours, and then the lipids run for 12 hours. At that point, everything, the tubing, filters, everything gets discarded, and you start from scratch if they're going to get another infusion. I'm going to monitor the patient for any adverse reactions. So we're going to be doing vital signs on a regular basis. I'm going to be checking the site for any redness, drainage. I'm going to check them for fever, basically any abnormalities. We'd stop the infusion and kind of address that. Worst case scenario, if we had to call the physician, we would do that. And yeah, from there, we will just continue to monitor the patient and answer any questions. I believe that's it. Sorry, I'm not very used to filming myself, so I probably talked way too fast. But see you guys soon. Thanks.